Dr. Gopijan, MD, Star Hospitals, HODs, consultants, nursing staff, paramedical staff, and member from the press. Back. And or let me put it this way, those of you who are interested in the history of how it came actually, that about 10 years back, the health industry started talking about that, how do we, assure quality, how we do build quality. And this was basically because, there was a little bit of pressure from the medical tourism, and Ministry of Tourism rather was after the Ministry of Health that you must have some mark of excellence which should be given to some hospitals, so that we can tell the people coming from overseas, that you can visit this kind of hospital which are safe in all respects, But Ministry of Tourism, and that is the way it came to Ministry of Health, and then Ministry of Health assigned the task to the Quality Council of India, that how can you design the accreditation program in this country which should meet the global benchmarks. So right from word go, the requirement was that this accreditation should be as per the international standard, not the domestic standard. And we started working on that, and we took about almost 10 months of time, and in February 2006, the accreditation was launched in the country first time. Now you must also know that this accreditation is not any other kind of certification. No, accreditation here very importantly is focused on two aspects. One is the patient safety. Actually, I would rather say patient safety is the key. And then of course the quality of care, that how the patient or their associate, their family members, how actually they are looked after by the hospitals. So these two aspects were included in this, and then a hospital will have to demonstrate that it has the necessary systems, necessary procedures, processes. They follow what he was saying, telling you that evidence-based, protocols and the practices, procedures are being, followed by the hospital. And finally, the most important point equally is that the hospital now will be required to monitor and measure the clinical outcomes. That actually will decide that the hospital is really going in the path, it's improving day by day, improving the clinical indicators, and that is also will be the factor by which the NABH will continue to maintain or continue to grant the accreditation. So it is very important now for the hospitals. In fact, the responsibility of the hospital now becomes manifold by way of this accreditation. The fact is that this accreditation, as I told you, is based on the international standards. Our standard is approved by International Society for Quality in Healthcare, which is the august body, global august body, which gives approval to the accrediting body world over. And that means this hospital now can boast that their practices or the treatment plan is put by all of you, and there is no doubt. But if I ask Dr. Gopijan that who are the 3-4 people, so he will call 5 people here, that these are for the objectives, then each one of you have to involve from day one, from now onwards. Each one of you have to take the ownership of the processes. And most important, which I actually say from my side, is that the consultants or the HODs now will have to take lead role in performing the clinical audits. This clinical audit, we have also designed the program. We have conducted in Delhi, in Mumbai, we will be doing soon in Hyderabad and down south. So far, surgeon and physician, they never challenge because they are just doing the service. But by this, when they will measure those indicators, then they will actually know that yes, so far we are here. We will also be sharing with you the national bench to make the healthcare safe. And finally, for the people of the press, they keep asking me this question that by accreditation the services of the hospital become costlier. I want to tell you one thing here is that the large number of hospitals, if I am given to count the nursing home Chota nursing home say, big hospital. I am told it is around 40,000 in the country, and less than 100 actually, if are accredited today. So you can see itself this is not a easy task. But I also want to tell you that in accreditation, some people call me that no, you are going for, or the accreditation is going for some 5-star culture. It is not 5-star culture. You can build a very simple hospital, very simple look, but you will have to ensure that the infection, medication, CSSD, laundry, all these functions which contribute to the infection are made as per the IPHS standards, and that is where sometimes initial cost has to be incurred. But if you ask me as a Secretary General of the Quality Council, we are shortly releasing the standard on the nursing excellence, which will pass it on to you. It is part of the NABH, but we have taken it out so that the nursing could be specifically trained and more importantly empowered, so that they share little more workload and reduce the burden on the physician and in short on the clinician. So the nursing has to play a leading role. I would like to see that the nursing come forward, take a dominating role in the practices of the accreditation, because that is the only way that this can be translated down the line up to the paramedical staff. So at the end, I am here to say that the NABH mission was that we have quality healthcare, safe healthcare in the country. This movement has started. Regulation is also coming in the country very shortly. It has already been adopted by the Parliament. So that time the accredited hospital has to take lead role in becoming the role model for other hospitals in your vicinity who are not accredited, let's say, to guide them at least to some extent to provide the safe healthcare. And as the head of the NABH or Secretary General Quality Council of India, I am very proud that the Star Hospital has joined the family of the NABH accredited hospitals in the country. And you have done rather, I say, proud to us that we can now tell everybody in the country and abroad that there is a Star Hospital in Hyderabad, which is by all means follows the protocols, international protocols, and all people can go very safely with confidence what is the treatment here. Thank you very much for this.